Dr. Shannon PT with our episode of Need to Know in 5. Did you know that November is Prematurity Awareness Month? This is a very important topic that we're going to be discussing in today's session. Did you know that 1 in 10 children are actually considered born premature? That is a baby that is born before 37 weeks. So chances are that you probably know somebody or maybe yourself that was born premature. So this is important to keep in mind for not only parents, family members, but for also therapists when we're working with the children and the different ways that they're developing and what they have access to. The first thing that is usually identified for a child that was born prematurely is you'll hear doctors and medical professionals refer to something called the adjusted age or corrected age. And this is done to try and help give families a little bit better idea of where their child should be at in reaching their developmental milestones. So, for example, if your child is currently 6 months of age, but they were born 2 months early, you would refer then to their corrected or adjusted age at being at a 4-month age range. And this is because you expect your premature baby to be engaging in activities and milestones that are closer to a baby in 4 months in age versus the 6 months in age. And so that's a really important factor when we're working with premature babies to make sure that we are doing activities that's appropriate for which we should see in their development. The other thing is we want to be patient with our little ones. As we can expect, when a baby is born early, there's a lot that's going on with their bodies from a developmental perspective, and then playing catch up on just getting to where they need to be as similar to a full-term baby. And then it's going to take that extra time for them to work on developing their different fine motor and gross motor skills. So be patient. Majority of the time, studies show that the babies usually catch up between around 12 months to 3 years of age. And so it just takes some time and practice for your little one to work on all of these things and get up to where they need to be. Most states offer what's called an early intervention program. And early intervention programs are for children that are from birth to age 3. So one of the things that's really important to note is that the early intervention programs, you actually don't need a medical referral to obtain services in your state. Of course, you want to have your medical professional team on board with whatever your child may need for their developmental supports, but you can visit the CDC website, and you have it right here. We have it for you. It's a great place to get resources for your state where you can just go on, and there's information right there that you can get the direct phone line to reach out to your early intervention program. As part of early intervention services, your child may be referred to occupational therapy services, speech therapy services, or physical therapy services. And so in physical therapy services, you may be using different things to help with developing their standing and walking balance, and items such as the little balance box might be a great option to help your child work on developing those gross motor skills as part of their early intervention program. Please feel free to check out some of our other videos where we talk about the different features of the little balance box and how it is designed to help stimulate, motivate, and promote your child's gross motor development. The other important thing to note is just because you have a premature baby doesn't necessarily mean that your child will have delays in all of the different development aspects. So for example, your child may do very well with developing all of their gross motor skills on a timely track, or maybe they are even developing them on an earlier side, but they have problems with speech and language development. So this is where it's important to get access to those resources early to make sure that you are catering to what your child needs in their development for whatever that may be, and getting the resources that they need early on. You don't want to wait until your kid is entering preschool to find out that there were different resources that you could have taken advantage of early on to be proactive and getting those different things in to help while your child's brain is still rapidly developing during this 0 to 3 time frame. Thank you so much for watching. See you next time on the Need to Know in 5.